Hi, good morning, and this is Dr. Bhatti, a plastic surgeon practicing hair restoration surgery as a profession. When you place a film star's 10-year hair restoration surgery in one column and a lesser-known corporate director, Mr. Sharma, in another, what emerges is a story of opposites. And I'm not talking about fame. I'm talking about density. I'm talking about expectations. I'm talking about clinical realism. So Gavi, a working film actor, walked into the clinic some 10-12 years back with quality donor hair with density of about 70 to 85 follicular units per centimeter square in the donor area. No comorbidities. Stable hair loss, more or less. So his biology was excellent. And over 2-stage sessions using the DHX FUE technique and careful high-density packing, targeting 55 to 60 follicular units per centimeter square in the first session, his hairline evolved into an on-screen shade, so dense that even wet in the pool, with the sun blazing overhead, his scalp showed more shadow than shine. He passed what I've named my wet hair density test, a visual endpoint I only reserve for my patients who live constantly under harsh highlight scrutiny like Gavi Chahal. In contrast, any other typical patient, like Mr. Sharma, only needs 35 to 45 follicular units per centimeter square, a density that creates natural illusion of fullness, easily holds up under casual lighting. And this density is intentionally limited to 50% of native capacity to protect donor hair reserve and ensure optimal graft survival. So why do celebrities need specifications of Superman? There's biology here. And then there's camera-grade reality. A non-actor walks into a cafe, bright lights blend softly, whereas an actor walks into a set under lights so strong that they pierce skin. Spotlights, 4K close-ups, arena flooding, and any thinning is magnified. And that's why actors like Gavi Chahal demand density closer to the upper edge of survival. And that is 60 to 75 follicular units per centimeter square, rather than the safer, usual 40 to 45, maximum 55 follicular units per centimeter square in most clinical cases. The goal in a normal hair transplant surgery is visual restoration, not pixel-perfect coverage. Under daily lights and distance, where the scrutiny is not so intense and critical, good enough at 40 to 45 follicular units per centimeter square is almost indistinguishable from almost perfect. But in both patients, the goal is the same. Make finite follicular unit numbers seem infinite, optical illusion. And the trick here relies not only in raw graft numbers, but on strategic angulation, shaft calibre leverage, and hair color contrast. All illusions calibrated on the day of the surgery. Even at 45 follicular units per centimeter square, if the hair is thick, the hair is dark, the hair is curly, it performs better than higher raw numbers. Mathematics does not always win over optics. So what I always tell my patients is the comparison between a garden and a forest. A transplant isn't a magic forest under your skin. It's planting an orchard with some spacing in between two plants, tailored for growth, tailored for performance, at the same time giving illusion of density. If you were expecting your old Sundarbans forest look or Amazon forest look like you had at 18, the result will disappoint you. But if you aim for a mere orchard with 40 to 45% density of plantation, most casual visitors won't even notice. Here's a quick comparison which will help you in deciding at what density the illusion of fullness will be created in non-wet hair. So the wet hair test is not a gimmick, it's just a mere guide, and a guide for only a few people. And here's how I use it. At the 9 months mark, after shampooing and under neutral lighting, the patient runs his fingers through his hair. If sparse patches show and holes are visible, light passes through, I call it a wet hair reveal. And this becomes a guidepost for whether a second hair transplant session is needed, provided scalp reserves and scalp vascularity, that is the blood supply, permit. No actor can afford the risk of being exposed under the lights. They need margin. But for the rest of us, passing the wet hair test is optional. It might still look great in the mirror, especially if people are 6 feet away. So the final take-home message today is assess, counsel, and calibrate. Assess your donor density. Set realistic expectations of density. Realize that we are creating an illusion, we are not creating natural density. And lastly, use the wet hair test as a benchmark in high-stake cases. Not to scare, but to steer further restorations. So thank you for watching. If you have any questions, any doubts in your mind that are lingering about hair loss treatment for men and women, about hair transplants in India, or anything related to hair, just put a comment in the comment section below and I'll get back to you shortly. Have a nice day and God bless you.